It's Morning Edition from NPR News. I'm Renee Montaigne. And in Your Health today, we hear about dizziness and balance. We have a look at physical exercises that can improve balance problems that can crop up as we age. First, NPR's Allison Aubrey reports on a common type of vertigo that's easy to treat once it gets diagnosed.
If you've spent any time on playgrounds, you might recall that kids seem to get a real kick out of swinging and spinning. Whether it's the excitement around this carousel spinner or flying high on a swing, for children, there's a novelty to that feeling of dizziness. But not so for many older adults. 83-year-old Adele Freed says about a month ago, she sat up in bed one morning and had the distinct sensation that she was drunk.
I remember everything was spinning, and when I tried to get out of bed, the walls were moving. And I just didn't have any balance. It was a frightening experience for me.
And did it come on all at once?
Yes.
When Freed went to see her internist, he put her on the dizziness medicine meclizine. But when she didn't get any better, she made an appointment to see Timothy Hain, a physician at Northwestern University, who's known there as the dizziness doc. Hain diagnosed her with a type of vertigo called benign paroxysmal positional vertigo, or BPPV for short. He says about 1 in 5 patients referred for dizziness have this condition, and he told Freed he could help her.
Yes, this is really a success story in medicine, and where we figured out the cause of this condition and we figured out how to treat it.
Hain explains the cause is really pretty fascinating. Within the inner ear, there's a little pouch called the utricle that contains, and here's where it gets kind of funky, about 1,000 tiny little pebbles, actually crystals of calcium carbonate. And it turns out these rocks are key to our sense of balance. When everything's working properly, the little pebbles in both our ears stay securely attached, and they help send signals to our brain, guiding our sense of movement. The trouble comes when the rocks fall off and roll into one of the inner ear canals.
And if they fall into it, then they're at the lowest part of the inner ear, and they just sort of stay there.
And then every time you reorient your head, say going from a sitting position to lying down, or just bending over to reach for something, the rocks roll around in this sensitive canal and make you dizzy. Adele Freed says when Dr. Hain explained to her that rolling pebbles were the cause of her vertigo, she was surprised.
I had never heard of it before.
Hain told her the cause could be anything from aging to a head injury or a virus. But Freed says she was very relieved when he explained that his physical therapist could likely correct the problem with a series of simple head movements that can be done in a few minutes.
I was amazed that the whole secret to what I had was to get those crystals back in place.
The treatment Dr. Dizzy uses is now widespread. Here in D.C., at the Washington Hospital Center, an audiologist named Saul Streeb demonstrated the maneuver with one of his patients.
What I want you to do is keep your eyes open and tell me if you feel dizzy.
On Streeb's table is patient Geeta Tiwari. She's sitting up wearing a pair of infrared goggles that pick up her eye movements and project them onto a computer screen so Streeb can monitor them.
How do you feel?
Good.
Streeb then tells her to quickly lie down on her back.
We're looking at her eye movements. So if we saw some rotary eye movements, for example, that would suggest a problem with loose otoconia.
Otoconia being the fancy name for those ear rocks. He then guides her through 3 more movements, turning her head to the side, rolling onto her left, and then sitting up. So remember the silly, dizzy kids on the playground? Their eyes spin just like Streeb's vertigo patients. But everything is fine when they get off the ride because nothing in their inner ears is out of place. For adults with loose ear rocks, Streeb's job is to try to get those pebbles back in place. He says the sequence of head movements usually works.
It's not 100% successful all the time. I mean, sometimes it just takes repeat visits.
Patient Adele Freed says it took 2 visits with her physical therapist to relieve the dizziness. She says on a scale of 1 to 10...
If it was 10, I'd say it's a 1 or a half a 1. It's night and day.
Dizzy doc Tim Hain says for most patients, even those who opt for no treatment at all, the rocks may eventually clear out on their own. And over the course of several months, the dizziness diminishes. Allison Aubrey, NPR News.